Hello, everyone. Welcome to Toolkit Talks. My name is Jennifer Smith, and I'm a Public Health Resilience Coordinator with the Office of Public Health Practice, Planning, and Local Partnerships, and CoCares, the Colorado Alliance for Resilient and Equitable Systems, serving the healthcare and public health workforce. Today in Toolkit Talks, this is video 1 for the Racial Justice Competency Model, or the RJCM, which is an implementation toolkit for public health. It was brought to you by the Public Health Training Center Network, the National Network of Public Health Institute, and the National Coordinating Center for Public Health Training. And again, this is video 1, so welcome. During 2020 to 2021, the Public Health Training Center Network, in collaboration with the National Coordinating Center for Public Health Training, housed at the National Network of Public Health Institutes, coordinated developmental events for the creation of a racial justice competency model to support the public health workforce capacity building efforts. And here you can see all of the creators here: the Public Health Training Center Network, National Coordinating Center for Public Health Training, and the National Network of Public Health Institutes. If you're new to Toolkit Talks, the objectives really are the CoCares team wants to lighten the burden of healthcare workers in management and finding toolkits to help your teams and organizations. We want to take a deep dive into a toolkit we find very useful and divide it into smaller sections to help you more easily implement it in your organization or your team. We want to showcase and bring awareness of already developed toolkits and expand on them to create an ease of implementation. So as you can see from the introduction, we did not create this toolkit. We are just showcasing it here and bringing it to your awareness because we do think it's really important. We need to focus on health equity and public health. We need to focus on racial justice, and this is a great toolkit and to make that happen. So this is our video topic list. We've broken down the RJCM into 6 videos. The first one will be the introduction to the toolkit and an overview of the racial justice competencies. The second video will be going into further detail about what is racial justice. Video 3 will be when to use the racial justice competency model. Video 4 will be how to use the racial justice competency model. Video 5 will be surveys and self-assessments that are part of the toolkit. Video 6 will be assessing the impact and then next steps. So today we'll go through the introduction to the racial justice competency model to get you started. Make sure that when you're watching these, I always say it is good to have maybe printed off or looked at the toolkit on the racial justice competency model before diving into the videos, just so you have a little bit of awareness, or you can make notes on it and things like that. So go ahead and do that if you haven't already done that. We will make sure to put every link and everything you need into the description on the YouTube channel. So their purpose and intent of the toolkit is to ensure the public health workforce is able to understand and address the intersections of race, ethnicity, culture, and health. They aim to provide public health professionals with a resource to reflect upon the knowledge, skills, and values needed to provide equitable, culturally competent care and services to all individuals and communities, regardless of race or ethnicity. They want to help ensure public health professionals are trained to identify and address structural and institutional racism, which is a major driver of health disparities in the United States. So why use the racial justice competency model? It serves as a tool to combat racism in public health work and the field of practice. It enables public health practitioners to be able to challenge organizational policies and equity initiatives that uphold institutional and structural racism. It helps ensure that public health professionals are properly equipped to understand and address the intersections of race, ethnicity, culture, and health. It provides an overview of the necessary knowledge or skills to connect theory to action and have measurable impact. It allows organizations to better understand and respond to gaps in training. It provides accountability to addressing health disparities and bringing about true racial justice. So there are some foundational elements needed in order to successfully implement the RJCM. They recommend that you have commitment. So you want to ensure commitment from the organization to infusing these competencies within their workforce and teams. With a team aligned, but misalignment of organizational values, principles, and practices, unintended consequences may arise that could negatively impact the culture and teamwork of the organization. It helps with any pushback because you already have that organizational commitment. Pre-work can include strategic communication about the commitment and planned use of the model. So that could be something that you announce strategically to the organization and to everyone there and how you're going to use this so that they have a little bit of a heads up that this is going on. I think that's important as well. You should make sure you've assessed everything. So you need to identify readiness and current status of racial inequity within the organization, identifying areas of improvement, and developing an action plan. You need to assess possible pushback. You need to identify areas of improvement. You should identify and develop an action plan. You should develop mitigation strategies for any pushback. And then implementation. So it's guided by your action plan. So you do want to make sure you have a good action plan. You want to make sure the organization is making meaningful progress to achieving its goal. The process to address a complex societal and structure issue like racism requires courageous organizational leadership. Fixing racism is not an easy thing to tackle. It's going to take a lot of courage and a lot of work. So there are some crucial questions for the organizations or teams leadership to ask before beginning to use the RJCM. Some of those include, what is the intention of the organization regarding racial justice and health equity? Is this intention clear and shared with internal and external partners? Is this intention in alignment with other organizational goals? Does the organization have any current racial justice or health equity goals? What are they? How can this competency model be used to further those goals? What is the organization's readiness for cultivating and experiencing these competencies within its workforce, within the organization's policies, practices, and programs? Will such competencies be valued and nurtured within the organization? So here, the racial justice competencies and their domains. So they created three main domains, which are assessment, policy development, assurance. And they all surround equity. So all of these domains and all of these competencies will have a main focus on equity in the middle. So assessment, you can see they have assess and monitor population health, investigate, diagnose, and address health hazards and root causes, which they did spell wrong there. Apologies for that. Policy development, communicate effectively to inform and educate, strength, support, and mobilize communities and partnerships, create, champion, and implement policies, plans, and laws, utilize legal and regulatory actions. And in assurance, they have build and maintain a strong organizational infrastructure for public health, improve and innovate through evaluation, research, and quality improvement, build a diverse and skilled workforce, enable equitable access. They say that these statements can be used as guiding points to help individuals or organizations gauge where they are, or as a guide for those who may not know where to start. This is a great starting point. They say this work is a commitment and a lifelong process. It's not a checklist by any means. It will be ongoing, and it should really be inserted into everything that we do within public health.
Okay, so here are the slides for the racial justice competencies. These were created for public health professionals specifically from the Public Health Training Center Network. So these are their competencies, and we will go through them together. So as you can see, these are a lot of words that they are sharing here. So it will be very wordy, so I apologize for that. But we're just going to go through a couple of these, and then you can go back and look at these on your own. So again, they've worked a lot on this model. And as we went over, they have 51 total statements in their racial justice competencies, and they've broken them down into introductory level, intermediate level, and leading level. So you'll have your main domain on the left, kind of where they fall under, what the competencies fall under. Then you'll have an introductory level, an intermediate level, and a leading level. So I think most people will probably start off in the introductory level, and that's totally fine. Look at some of the buzzwords that you see in here. I think a lot of the introductory, especially, and some of the intermediate really are talking about recognizing and describing, identifying, things like that. To kind of go, okay, where are we in this process, right? Great topics for conversation. And then a lot of the leading levels are more at the level of managing, creating buzzwords like that. So we're going to go through a few of these. We are not going to go over the entire list because it is way too long, but this is something to definitely look at later. They do provide a lot of examples as well. That takes up a lot of space, but it's really great to just talk about with your team, with your organization as you're starting this process. So you can see on the left, they have the first domain, which is assessment. And an introductory level of assessment would be examine social issues and messages for racial biases. Excuse me, examine social issues and messages for racial biases and their impact on oneself and others' thinking, emotions, and behaviors. So this is where you're just starting to examine those issues, right? Those messages. Then an intermediate level would be evaluate the effects of policy issues and actions on BIPOC and other marginalized groups, both within and outside the organization. Okay, so that is like the intermediate level of looking a little deeper at these effects of policy issues. And then a leading would be manage emerging issues using systematic problem solving and adaptive skills. Okay, so first we're examining, then we're evaluating, then we're managing. So the last one there, we'll go over that one. So an introductory level for assessment would be describe historical and current conditions that contribute to disparities in health outcomes between populations. So this could be a great way to bring this up in conversation and have a group discussion about something like this, right? So you're just describing these historical and current conditions. Then the intermediate level would be examine historical and current conditions that actively contribute to disparities in health outcomes between populations today. So again, you're describing it, then you're examining it and getting into it a little bit more about today's issues. And then the leading would be create mechanisms for addressing historical and current conditions that contribute to disparities in health outcomes between populations. So again, this is creating. So you're starting to create something to address these issues instead of just describing them and examining them. Okay, and it may take a long time, and it's fine to get to that leading level, but this is all learning, and this is all getting better at racial justice. So again, they continue here on the next page with some more assessment domain. So an introductory again at the top, you can see identify assets and resources for improving health in a community. For example, community coalitions, community-based organizations. So you're just identifying, right, all these resources that you can lean into. And an intermediate level would be create opportunities for individuals and organizations within a community, including non-traditional or unconventional partners to collaborate and improve health. So these are where you're identifying, now you're helping to create opportunities from what you've identified. And a leading would be support opportunities for individuals and organizations within the community to maintain assets and resources for improving health. So you can see you've went from identifying assets to creating more opportunities from those that you identified, and then you're on to supporting these opportunities once they're already there. And then you can see policy development, which again, I'm sorry that I don't think these slides came out very well once you pulled them up, as far as, alignment. But policy development, you can see the first one there at the bottom, describe racial justice and health equity concepts. For example, race, 4 levels of racism, health inequities, root causes of inequities, social determinants of health, privilege, oppression, implicit bias, racial justice, and then the relationships among them. So again, great conversation to start off your introductory level of policy development. Then the intermediate level would be examine the historical role of racism in medicine, public health, intersectional oppression, and racial justice strategies. So you're just kind of going a step further there with that intermediate level, and describing more of that role in these things, right? How does it relate? And then a leading level would be identify opportunities for organizational, regional, state, and federal policy changes to address inequities. So that's when you take it a step further and you're really looking at your policies, different policies, and identifying opportunities for change. And then you can see more, a whole page on policy development domain. We'll start like at that second one there. So an introductory could be recognize how privilege and power dynamics appear for oneself within the organization. An intermediate level of that would be identify how privilege and power dynamics influence policies, programs, and services within the organization and community. And then the leading level is organize conversations with community, governing bodies, and elected officials regarding policies, programs, and services that address inequities and strengthen the community. So again, in each of these, you can see how they just kind of started off by recognizing and examining, and you're identifying and implementing and then organizing, right? So you're just taking it a step further each time once you've learned and gone over more. So great places to start working through this. So then we have the assurance domain here on the left. We'll start at the top. An introductory level would be share resources, approaches, and tools on structural racism, racial justice, and health equity work. Intermediate would be advocate for health equity, social and environmental justice. For example, sharing power, educating the public and policymakers, and influencing funding. Then a leading would be critique structural and systematic racism embedded within public systems, policies, and practices to advance health equity. Again, you're just getting stronger and stronger each time with more learning, more information, and just more time working on this. So the second one there, you can see the introductory is define the roles of public health in addressing and dismantling racism and systemic discrimination. Intermediate would be identify strategies for assessing equity, diversity, and inclusion of BIPOC and other marginalized groups in the public health workforce, including at the leadership level. A leading would be create strategies to sustain a diverse and inclusive public health workforce. For example, recruitment, retention, promotion practices, creating an inclusive, safe work environment, respecting diverse perspectives, sustaining a culture that values collaboration, peer learning, flexibility, and equal opportunity. So I think these are wonderful places, again, to really work through this process. And again, they say at the bottom there, you can see that this is a lifelong process. You'll have to gain a lot of knowledge and skills, a lot of training, I think one of them that we just read was sharing resources. Great place to start, sharing resources and training with each other so that you can learn as much as you can. And then make sure to contribute that feedback that they're asking for. So again, this slideshow here was created by the RJCM and their creators. And you can find this. We will have a link in the description. So make sure you check that because I did not go through the whole
Our
list.
next video, we'll be talking more about what is racial justice. So we're going to have a racial justice and health equity discussion, and we're going to go into some of the terminology that they do have in all of their materials for the racial justice competency model. So we look forward to seeing you then, and we appreciate you taking the time to listen today and watch today, and take care.